Hello, my name is Nancy Freed. I am a registered nurse, and I'm also currently a student in the Masters of Nursing program at Wilkes University. This video assignment is to show how I will perform an advanced physical assessment on a patient that's coming in with multiple symptoms. The assignment for the adult physical assessment is based on the following case. Mrs. J is a 39-year-old woman who presents to a primary care center for evaluation of headaches. The headache is a pressure across her forehead and is 4 to 5 over 10 on a pain scale, usually lasts an hour or so and occurs 2 to 3 days per week. And this has been occurring for the last 2 to 3 weeks. This headache became more severe yesterday, lasting for several hours, and was a 7 over 10 on the pain scale. She reports fatigue, nausea, feeling hot, and slight muscle weakness in her right hand, but denies vomiting, floaters, polyuria, and polydipsia. She also reports very heavy periods for the past 6 months. She isn't sure if she is catching a cold because several of her coworkers have been sick, and she feels like she's getting a stuffy nose and her neck is sore. Hello, my name is Nancy. I will be your nurse for today.
Hello.
So, what is your name?
You can call me Mrs. Jones.
Hi, Mrs. Jones. Very nice to meet you. What brings you into the clinic today?
Oh, I've been experiencing this severe headache for the past 2 to 3 weeks.
Oh, I'm so sorry to hear that. Have you been experiencing any signs such as nausea or vomiting?
No.
Okay. Where's the location of the pain of your headache?
I feel like the pressure in my forehead.
And what brings upon the headache?
I've been having this heavy periods that I've been experiencing for the past 6 months, and also I feel like I'm getting sick. I think I'm catching a cold. My coworkers are also sick. I feel like my nose is stuffy, and at the same time my neck and my head is sore.
Okay. Is there any specific time of the day that you get the headache the worst?
It comes and goes. It doesn't come any day or night. It comes and goes intermittently.
Okay. Please, Mrs. Jones, on a scale of 0 to 10, with 0 being no pain and 10 being the worst, what would you rate your pain?
This time it's 4 to 10, but yesterday was really severe. It was a 7 out of 10.
Okay, and have you been taking anything to help with your headache?
I take Tylenol for the headache, every 6 hours as needed.
And how long have you been taking this Tylenol for?
Almost 2 weeks.
Okay, do you feel it's helping you at all?
Sometimes it does.
Okay. So you said no, you weren't vomiting, you feel a little nauseous. Have you been urinating a lot, or have you been feeling like you're always thirsty?
No.
Okay. And have you been having, with the headaches, any problems with your vision? Have you been seeing any blurry vision or any spots or halos?
No.
Okay, well, if you don't mind, I would like to check your vital signs, and I would also like to do an assessment on you.
Okay.
After interviewing the patient who came in with a chief complaint with multiple symptoms, I will now perform a physical assessment on this patient. I'm going to start off with taking her vital signs, and then I'm going to check her heart and lung sounds. Okay, your blood pressure is 103 over 83. I will also check your pulse rate. Okay, her pulse rate is 75, her respiratory rate is 18. Now, Mrs. Jones, can you please breathe in and out for me? Okay, I'm going to listen to the breath sounds on her back. Okay, thank you. After listening to Mrs. Jones' heart and breath sounds, I didn't know any rhonchi, rales, or crackles. Okay, next I will assess Mrs. Jones' head. So the head is normocephalic, no mass, no lesions present. I will also check the interior and posterior aspects of her neck and check the lymph nodes. I didn't note any enlarged or fixed nodules. Next, I will inspect Mrs. Jones' eyes. Okay. There's no redness, there's no discharge. The sclera is clear and white. Mrs. Jones, I would also like to look at your eyes. Would you please look at the light for me? Okay. Mrs. Jones, her eyes, her pupils are equal, round, reactive to light and accommodation. I would also like to look at the internal eye structures of Mrs. Jones. Okay. So there is a red reflex present. The optic disc is round and it's sharp. The fundus, the background, it has a reddish yellowish color. Next, I will inspect and assess Mrs. Jones' ears. Okay, there's no mass, there's no lesions present, there's no discharge. So on the adult patient, I will inspect inside the ears, examine inside the ears. I will pull the pinna up. Okay, the tympanic membrane has a pearly white color. There's no bulging and there's no perforation. Next, I will assess Mrs. Jones' nose by inspecting and palpating the nose. Okay, there's no lesions, there's no mass present. The nose is midline. I would like to examine inside of your nose though. Mrs. Jones, can you please tilt your head back and look up? Okay, so what I see is, I see that the inferior and middle terminates is visible. The nasal mucosa is glistening. There is a clear discharge noted. There is no perforation of the nasal septum. Next, I will assess cranial nerve number 1 olfactory, which is the sense of smell. Mrs. Jones, I would like you to close your eyes and include 1 nares and tell me what you smell. Okay, good. Now I would like you to include the other nares and close your eyes and tell me what you smell.
A perfume.
Great. From this assessment, I note that Mrs. Jones' cranial nerve number 1 olfactory sense is intact. Next, I will inspect and assess Mrs. Jones' mouth and throat. Okay, open up. Okay, I see the uvula is visible, it's not touching. I would like to test the gag reflex. Okay, I would like you to stick out your tongue and turn it to the left and right. Okay, this tests cranial nerve number 12, hypoglossal. Next, I will test and examine the motor functions of the hands. Mrs. Jones, this test is called the rapid rhythmic alternating movements. What I would like you to do is take your palm up of your hand and just go up and down, up and down. Okay, and then faster. Okay, good. Now I would like you to take your thumb and touch each finger of your hand, like this. Okay. From this assessment, I note that Mrs. Jones' fine motor functions to her hands, especially to her right hand, is intact. Next, I will assess Mrs. Jones' reproductive health history. So Mrs. Jones, you came in because you also said that you had some very heavy periods. I would like to know, when did you start first having your period?
When I was 12 years old.
Okay, so since then, would you say your periods are regular or irregular?
They are regular.
Okay, that's good. And so you're saying you have your period every 28 days?
Yes, I cycle every 28 days.
And what would you consider the duration of your menstrual cycle? How many days does it usually last?
Usually 5 days.
5 days. And during those 5 days, are you experiencing any other symptoms such as pain?
Yes, I usually painful menstruation within like the first 2 days of my period, and sometimes they're like accompanying of like a headache whenever I get my period.
Okay. And the consistency of your period, do you know any clots or any heavy discharge with it?
I noticed like a few clots on it.
And how many pads per day would you say you saturate?
5.
5 pads per day. Okay. Based on my findings of performing this advanced physical assessment of Mrs. Jones, the differential diagnosis that I come up with is migraine and hemorrhagia. I do have several recommendations for Mrs. Jones. I recommend you to get a CT scan and an MRI of the head to rule out any mass, lesions, tumors, and malignancies. I would also like for you to take an analgesic such as a Tylenol. This will help with your headache, your sore neck, and even it will help you out with the pain that you're having with your periods. I would like you to see a neurologist so they could further assess why you're having this weakness in your right hand. I would also like for you to go see a gynecologist so we could get a pap smear done to rule out any types of cancers and to further treat why you're having these heavy periods. In addition, I think it's best for you to get some blood work done so we can check your CBC and check your hemoglobin and hematocrit levels. Mrs. Jones, I would also want you to make a follow-up appointment to come back to the clinic to see me in the next 2 weeks, all right? And this concludes the advanced physical assessment of my patient for this video assignment.